Hi, my name is Damon Ingram, and today I'm going to be going over how to prolong knee health for catchers. I'm going to be giving you examples on stretches that you should be doing, exercises that you should be doing, when you should be doing them, and how many times you should be doing them. And I will be the voiceover giving you all the directions on how to do everything.
Just a disclaimer for the stretches that will be performed during this video series. A lot of these stretches are meant to be done after a workout or after a game. There are some stretches that you can do before, and they will be described during the video. Also note that these exercises that will be shown, you can do it in order or you can mix it up if you want to, but they are meant to be performed 2 to 3 times a week. It is not meant to go past that, or else you will just put more overuse and stress on your tendons just because you're overworking the muscles. If you want a recommendation on when to do these stretches, I recommend doing it right after the game or right after the workout, as I already said, or you can do it right before you go to bed or right when you wake up in the morning as well. So the first stretch that is going to be shown here is called the prone hip rotations. The client will be face down and they are going to use their hands as a resting point for their head to lay on comfortably. You are going to bend your knees at a 90-degree angle, and then you are going to slowly abduct your legs as far as it can go. Once you get to the point where you can't reach out as far as you can, you hold that for 2 seconds and then you bring it back up. This is going to be repeated on each leg for 10 reps, and you're going to be doing this for 2 sets. Again, I want to clarify to the people that you're trying to abduct your leg as far as possible. So for the next stretch here, it is called the performance stretch. You are going to lift your leg up towards your other leg that is going to be staying down, and you're going to have your foot lie on top of your knee, and then you're going to push the knee that is up down to where it makes a 90-degree angle. It is a really good stretch for the hips, and there's different variations to do this. You can do this sitting down, or you can do this lying down, or you can even do this standing. All variations are good, and they're all meant for different types of people that might be needing a little bit of a deeper stretch or might have a tough time trying to get down towards that 90-degree angle. You are going to be doing this stretch for 30 to 60 seconds per leg. You can do this for 1 to 2 sets. It just all depends on how sore you are and how much of a stretch you need. For the next stretch here, it is called the frog stretch. You're going to ask the client to leave the feet where they had them in the starting position, and then you are going to move your knees laterally away from the midline and have your forearms be a resting point for yourself, and you're basically just going to be leaning back and holding that position for up to 30 seconds, and you just repeat the movement for 2 sets. The next stretch is called the butterfly stretch. The goal here is to have the client be able to put their feet together and bring it close towards their hips, and you are going to be pushing your knees down to get a really good groin stretch. This can be done for 30 seconds for around 2 sets. This next stretch that we're going to talk about is called the banded hip flexor stretch. You are just going to need a band that has some pretty good resistance, and you are just going to either tie it on a pole or you can have a little clip on to be able to attach the band onto. Once you do so, you're going to put your foot through the loop and then get it right under your glute. And once you have it under your glute, you are simply just going to let the band pull your leg that is down forward. And just to clarify, when you are letting the band pull your down leg forward, you're going to get a good deep stretch on your hip. And to clarify, you do not want to just have your lower back get pulled forward. As you can see in this clip here, my whole spine stays neutral, which is very important. Once you're letting the band pull you, you're going to hold that position for 3 to 5 seconds, and then you're going to revert back to the normal position. You're going to want to do this for 5 to 10 reps, and this is one of these stretches that you can do before a workout because you're activating the muscles. Now moving on towards the knee stretches. This is a quadricep stretch called the quad pull. You are simply just grabbing your foot and pulling it back towards your glute and pulling up. There's no specific time or sets that you need to be doing this. If If you want a recommendation, I recommend doing it for 15 to 30 seconds on each leg. It doesn't have to be too long. It's just got to be plain and simple. Really get that good deep stretch for your knee. So now moving on to the ankle, we are going to have the band tied up somewhere or clipped on to a pole, and you are going to put the band on top of your foot so that way the resistance is pulling your leg back. And basically all you're going to be doing is trying to get the one leg that's banded into a deep squat, and you're trying to get your knee to go over your toes while there's resistance pulling your ankle back. And you're going to want to do this with your foot facing forward, your foot angled outside of yourself, and then your foot is going to be pointed towards the inner part of your body. And this is just to be able to activate the 3 different areas of your ankle mobility, and you're just going to be able to want to hold this for roughly 15 to 30 seconds, and you do not need to do this twice. For the first hip strengthening exercise, it is called hip hikers. This will be done for 2 sets and 10 reps on each leg. The client will begin by putting their one foot on the treadmill or step facing sideways, and then the other foot will be on the ground. From there, you are just going to do a single leg squat for 3 to 4 seconds on the down movement, and then you are going to push yourself back up. This is really good just for the eccentric of the knee. For the next exercise that we're going to do is called bridges. The client can start by lying on their back with their knees bent and hip width apart. From there, you will press your hips as high as you can while your shoulders press into the ground. This can be done for reps or time, so you could do it either for 2 sets of 10 reps, or you could do this for 2 sets for 30-second holds. Moving on to the next exercise called hip squeezes, you will be starting in the same position as you were for bridges. From there, you're going to put something as simple as a pillow or a foam roller or a yoga mat that you rolled up like I did in this video. From there, your goal is to be able to squeeze with your groin as hard as you can, hold it for 3 to 5 seconds, and then release the tension. You're going to be doing this for 2 sets and for 10 reps. Moving on to single leg raises. This is when the client is just raising one leg in front and then slowly bringing it down when you don't have resistance. You can also do this with resistance if you have a band in between both feet and you are just lifting the band to create that rubber band effect with the stretch. But without a band, you are going to be doing this for 20 reps on each leg, and it doesn't need to be more than just that. It's just 1 set. And lastly, side leg raises. This is the same concept with the single leg raises, except you're just lifting it onto the side, and your goal basically is to just not fall over when doing this. You're trying to go as far as you can while still contracting that core to be able to keep you stable. This will be just done for 2 sets and 10 reps. And now moving on to the knee exercises. First exercise we got is TRX banded single leg pistol squats. The goal here is to be able to do an assisted single leg squat with the TRX bands. And while you're squatting down, you should take about 3 to 4 seconds on the down movement until you hit 90 degrees. And then you can assist yourself back up when you get to that 90-degree angle. The main focus with this exercise is having an eccentric movement for your knee, just to release that tension and pain that you have on your knee. This will be done for 2 sets and 10 reps. For the next exercise we're doing, it is called backward sled walks, and you're simply going to have a band wrapped around your lower back and clipped onto the sled, and then you are going to get into a quarter squat to a 90-degree squat, depending on your comfortability, and you are just going to walk backwards. It's good to have at least 20 yards of turf to work with, and that you can do it for around 2 to 3 times. And now moving on to knee extensions. This can be done with free weight, like an ankle weight like I'm using in this video, or you can use the knee extension machines that you see at your regular gym. I just prefer using a free weight just because gravity can do its job better and it puts less pressure on your joints, which is very good for our scenario. So what you're going to be doing here is that you're just going to be kicking your foot up all the way to extension, and then you are just going to slowly lower your leg down as slow as you can. You're just letting gravity do the work, and you're just trying to let that ankle weight just slowly bring your leg down. This will be done for 2 sets and 10 reps. For the next exercise we are going to be doing, it is called terminal knee extensions. You are going to clip the band onto a pole around knee length, and then you are going to put the band behind the back of your knee. Once do so, and once you step away from the band to get a good resistance on it, you are simply just doing a quarter squat, letting the band take your knee forward towards the pole, and then you are going to contract your leg back and fully extending your leg and contracting, holding it for 2 to 3 seconds, and then doing the rep again. This will be done for 2 sets and 10 reps. Now moving on towards the ankles, you are going to start with toe raises. Toe raises is a very simple exercise. You're simply just going to find a wall anywhere that you have room, and you're going to lean back onto the wall, get your feet a little bit away from the wall, and then you are going to be lifting your toes up as high as you can, keeping your heels on the ground, and then you're going to let them go back down. This process will be done for 2 sets and for 10 reps. For the last 2 exercises, I'm going to show you both of them at the same time. E-versions are just simply having the band on both feet, and then you're just trying to move your ankle away from the midline. And then inversions, it's the same thing, but you're just moving the band into a different spot, and you are just trying to move your ankle towards your midline. Both of these are going to be done for 10 reps on each leg, and you're going to be doing it for 2 sets.